Living in pain is not normal. If you awaken with body aches or have pain at work, how are you going to relieve it? If your sons, daughters, or grandchildren are injured while playing sport, how will you treat them? If your parents or grandparents suffer from pain, how will you help them? Today, I will give you the solution that many individuals and patients have used to relieve their pain.
So I'm pleased that the Dr. Carrasco Pain Cream that he uses daily helps that much.
Welcome to the show. I'm Dr. Carrasco, the Pain Doctor.
I'm Dr. Alex De Jesus, rheumatologist.
Alex, good seeing you today.
Good to see you today. Today we're going to be talking about one of our favorite topics. Today is the day where we're going to discuss the Dr. Carrasco Pain Cream.
It's kind of selfish. You're talking about the cream that I created, but I appreciate you taking the time to make this our topic today.
It's something that our patients are going to be using all the time. They're going to be using medicines. Besides what you and I prescribe them, they're out there looking for something else. What else can they do for pain?
Well, I think, Alex, that after 25 years of treating patients with pain from their head to their toe, pain from headaches, from facial pain of TMJ, people who have neck pain, back pain, abdominal pain, menstrual cramps, hip pains, shoulders, knees, foot pain. All these individuals have done extremely well with this product because it's made to fit anybody who's got any type of discomfort.
I would like to hear from some patients.
Let's see what they have to say.
I've been suffering from neck pain and lower back pain for years. I use Dr. Carrasco's pain cream on my neck and my lower back, and I get pain relief instantly.
Dr. Carrasco's pain cream actually helps me in every way. I didn't think that it was going to help me the way that it has, but it has actually given me a lot of relief.
It has a very, very light kind of aroma. And it's very simple to use. It dries quickly, so I can put shirt and pants on right after I use it.
And he works at the computer, he's up and down, he unloads what trucks have come to the warehouse for delivery. And at his age, I am amazed now that he has something so supportive as the Dr. Carrasco cream. He stands straight as he can all day. He doesn't even use his cane anymore. So I'm pleased that the Dr. Carrasco pain cream that he uses daily helps that much. His stamina is unbelievable. Okay.
Alex, the patients you're seeing here in these testimonials, these are actual patients. These are people, I've been practicing for 25 years. I trained at the Cleveland Clinic, one of the best places in the world.
Still is a great place.
But you know what? I've seen people for 25 years with pain all over their bodies. And they all want one thing. They want relief, number one. Two, they want control. They want a plan. If I have pain, what do I do for it? This gives them relief, and it gives them a plan. And it gives them an option, gives them the freedom to say, if I have pain today, I'm not worried anymore because I got something I can do for it. But when we see a patient that's taken pain medication, probably more than you would want, muscle relaxers, anti-inflammatories, and now anything else they can find, it's good to have another option. But if I can give you this pain cream that gives you topical relief right where the problem is, it gives them another option that's safe and that's effective for them.
And I heard it took you about 3 years to come up with this formulation.
Absolutely.
What took you so long?
Well, it's not easy. You know, you'll see throughout today's conversation that there are many different topics out there, many different products out there, and so we had to figure out what's going to work best, and we had to try it on our patients, try it on ourselves, and see if it's going to work.
I think the fact that you put time into the trial and trying your patients is very, very valuable.
Look, I'm not just the creator, but I'm my own patient. When I'm on my procedure day, I have to stand for 2 or 3 hours and doing various injections or treatments for 2 or 3 hours. And sometimes if I exercise or whatever, my back hurts or my shoulder hurts. But I got to still stand there for 3 hours. The patients expect me to treat them. Well, what I do in the morning, like anybody else would, if you're hurting in the morning, you put the pain cream on the shoulder, put it on your back, and I can function through the whole procedure time with no problems. Coming up, I will share how the Dr. Carrasco Pain Cream is helping athletes at the junior high, high school, college, and semi-pro level, including football, basketball, volleyball, soccer, and other sports.
Well, by the grace of God, I was recommended to come here, and it's been the best thing in my life. I've lived with a lot of pain. I suffer from a combination of arthritis, fibromyalgia. I've had 2 surgeries on my neck. So I came here, I get injections, I get therapy, and just recently, he came out with a Dr. Carrasco's pain cream. I've been using that, and it just worked great. I can do most anything except play basketball.
I suffer from lower back pain, which has affected my balance. In the middle of the night, the pain on my thigh just wakes me up. I usually go for Dr. Carrasco's pain cream. The pain subsides immediately, and it doesn't bother me for the rest of the night.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
The Carrasco Pain Institute was established in 1992 by Dr. Arnulfo Tarin Carrasco and is housed in a beautiful 16,000 square foot hacienda located in the prestigious South Texas Medical Center in San Antonio, Texas. The Institute is staffed with caring and compassionate medical professionals, and the on-site surgical suite is state-of-the-art, equipped with the latest imaging technology. Our rehabilitation department helps patients return to a more productive, satisfying, and independent lifestyle. The medical spa provides a beautiful and relaxing environment, promoting health, hope, and healing. Our in-house studio is home to the Emmy Award-winning Dr. Carrasco Show. We invite you to visit us at carrascopaininstitute.com or call 210-614-4825.
Welcome back. I'm Dr. Alex De Jesus. Today we're talking about the Carrasco Pain Cream, and Dr. Carrasco, the creator of this formulation and of this pain cream, is here with us today. Arnulfo, I really want to know who is going to benefit from using a pain cream like this.
Well, Alex, thank you. I'd like to share some of these individuals' experiences with the pain cream. Let's watch those right now.
I'm a high school basketball player, and my knees and my ankles, they're always hurting every day in basketball practice or before a game. I love Dr. Carrasco's pain cream because it helps me so much when I'm playing games. I'm always sore and hurting, and I just apply it and I get immediate relief. My coach runs us all the time, so we need a pain cream. All the players, not just me, all of us use it.
My daughter likes to use Dr. Carrasco's pain cream when she plays volleyball. Really helps her range of motion when she goes to perform. All my family uses it. Since all my girls are in sports, Dr. Carrasco's pain cream is what they prefer using.
When I first came in, I could barely walk. Now I'm able to walk on a treadmill, keep my balance, do a majority of my therapies, and go home happy to my 3 kids. I like when they apply Dr. Carrasco's pain cream after my massage therapy because it helps me get through my physical therapy a lot better. Dr. Carrasco's pain cream does work for me.
Let's say right now you have shoulder pain. Well, we have 2 options. Give you a pill and hope that the body absorbs it, and a little bit of it ends up right here. But some of it ends up here, where you're drowsy, you're sleepy, maybe get addicted. But if I can put it right where the problem is, because it's a muscle problem or a joint problem, and it gives them relief, that's much better and much safer.
How about if the patient has rheumatism, everyday aches and pains?
Absolutely. This product works very well for either short-term pain or long-term pain.
One of the most common patients I see in the office is a lady, usually it's a lady with headache. How about a patient like that? Can they benefit from something topical, something like your pain cream?
That's extremely common.
People
have
common.
Muscle tension headaches. You know, muscles in your neck and your shoulders can cause pain to go up to that area of the head, as you mentioned. And so many times those muscle tension headaches, and also the migraine patient, the patient had pain for years and years and years, does extremely well with this product.
I suffer from headaches and cervical pain. I use Dr. Carrasco's pain cream 3 to 4 times a day. It helps. Any muscular, any kind of headache coming on, I apply it right away.
Well, the fact that it alleviates my pain allows me to function. I would absolutely recommend Dr. Carrasco's pain cream.
When I get up in the morning, I use the Carrasco Pain Cream. It makes me feel better all day long. My wife, she uses it all the time also, and she gets good relief from it.
It doesn't take hardly any at all to make you feel better, and that's what I like about it.
Well, it's not as messy either. You know.
True.
Dr. Carrasco's pain cream helped me sleep all night and helped me get through the day also.
People who have had pain for a long time, maybe they've had back surgery or hip surgery or shoulders, knees, wherever it is, they have discomfort. They live with pain. But now that they're using the pain cream 2 to 3 times a day, they come in the office, how you feeling? Do you think we need to do something else? Do you need some more therapy? Do you need injection? No, doctor, I'm doing good. My pain is controlled with the pain cream.
Happy for the patient, very happy for the patient that says that they're doing better.
But I do tell patients, if you wake up in the middle of the night which has happened to me.
Night pain.
A little bit of pain in the middle of the night, and you're turning and you toss it in bed because your shoulder hurts, because your back hurts. Get up, put the pain cream on. I promise you go back to sleep. But you know what? Let me ask you this. You use it on some of your patients. How does it work for them?
It treats a broad number of conditions, just like you've been explaining, and it's a wonderful addition to whatever treatment we have the patients on.
And in fact, somebody the other day said, my daughter's having menstrual cramps. What can I do? Put the pain cream on it. Guess what? It worked tremendously well for menstrual cramps.
Coming up, I will share how the Dr. Carrasco Pain Cream is helping people who suffer from pain resulted from muscle spasms, joint pain, spine, diabetes, and shingles, as well as people who've undergone previous surgery.
Do you want to solve your pain problem? We have the solution. Dr. Carrasco's Pain Cream really works and will give you quick-acting pain relief. Most pain creams have long-lasting odors, can stain your clothing, contain dangerous preservatives, leave greasy residue on your hands, but not with Dr. Carrasco's Pain Cream.
Smells good.
The comfortable roll-on is easy to use, whether for acute or chronic pain. This is the solution you've been waiting for. It works so well that you may ask yourself, how did I ever live without Dr. Carrasco's Pain Cream?
I apply the Carrasco cream to my knee. I have had considerable knee pain from numerous falls and some arthritis too. My energy level has come up because I'm active again. My pain has gone way down.
Dr. Carrasco's Pain Cream is a quick-acting, long-lasting pain relief in a comfortable roll-on. It can be purchased at a simple price of $20 plus shipping and handling. Call 210-614-4825 or online at carrascopaininstitute.com. The Dr. Carrasco Pain Cream is not available in stores. Please select from the 2 convenient purchase options and we will send it to you immediately. Buy it today.
Living in pain is not normal. If you awaken with body aches or have pain at work, how are you going to relieve it? If your sons, daughters, or grandchildren are injured while playing sport, how will you treat them? If your parents or grandparents suffer from pain, how will you help them? Today, I will give you the solution that many individuals and patients have used to relieve their pain.
This pain cream is wondrous. I don't take pain medication anymore at all.
Welcome back. We're talking today about the Dr. Carrasco Pain Cream. Arnulfo, this is your formulation. You have done this for patients. What patients are going to benefit from using a product like the Dr. Carrasco Pain Cream?
Thank you, Alice. Let's see some patients who benefit from the pain cream.
I got hurt at work because I did repetitive typing and I was not able to use my fingers anymore, my hand. I started feeling a lot of like a stretching, burning sensation up my forearm. And I've been going through a lot of therapy and surgeries. Thanks to Dr. Carrasco Pain Cream, it has decreased my pain a lot. So I'm able to use my hand to open the door, unlock the door, and open the door to my vehicle where before I couldn't do. Everything was done by my left hand. And I'm happy, I feel alive, I feel like my hand has been reborn.
Judy has had back pains for quite a while. She was in a bad car accident years ago when she was young. I bought it for Judy. When she has some spasms, it helps her out to get through the day and also through the night. It really works and it helps her out and it also helps me out.
I started using the Dr. Carrasco cream before my first appointment. I was referred here and I looked him up on the internet and I got the cream and that helped. The Dr. Carrasco Pain Cream is in a roll-on, which is great. It's convenient. I carry it in my bag all the time. I apply it to my knees, really anywhere you're hurting. My energy level has come up because I'm active again. My pain has gone way down.
How many ingredients did you end up putting in the combination?
We took 17 ingredients, and it's not about the ingredients because anybody can go buy these ingredients. It's the right formula, the mixture that I work with some chemists and some pharmacists to make the right amount there. But the ingredients that are important that we mentioned earlier, 17 ingredients, but it's got menthol, commonly used for many different types of products throughout the years. Camphor, again, is there. Yerba Buena, which is a good anti-inflammatory, and Arnica, and Aloe Vera. Now, you can go to the pharmacist or the Walgreens or wherever you want to go and see shelves of pain medication. And some of them just have one of these, but they don't have all of these. What I did is I studied all these ingredients, which of these ingredients, the primary ones being the menthol, the camphor, Yerba Buena, Arnica, and Aloe Vera, are on the shelves because they worked. And guess what? I put all of those into the product. All in one.
And 12 more.
And 12 more.
And 12 more, so you definitely added a lot.
So I forgot to mention one thing. You have arthritis patients that, when you have arthritis, you have trouble opening things. So what did I do for that? Can you tell?
I noticed that the cap is not smooth. The cap is corrugated, so it'll give you grip. It really
Exactly.
is big enough to grab, even if you have hands that don't grab a lot.
Because some arthritis patients, they can't do this. They can't make a fist.
They can grab kind of big things, but they will not be able to use their pincer or their fine motor movement.
So does this work for them?
That has one good hand, can grab it with one hand. For years, I've been formulating compounds and in multiple combinations. I don't know if I can show you my prescriptions.
I know you have.
Trying to look for that combination that offers pain relief and potency and lasting. And so the pharmacist has to go there literally manually and mix and match my proportions and dispense one tube, and that's just one tube.
And how long
to
does
the
it last?
patient.
And how long does that tube
That
last?
tube is not recommended to be used for more than 28 days. It's meant to be used and then thrown away. So the cost of that, which is in the hundreds or several $1,000s, compared to the cost of something like this, it's remarkably much more convenient to the patient to buy something like this. And then even after the first time it's been opened, it's going to have an extended shelf life. You said 1 or 2 years. It's proven to be available on the shelf and be still good.
When you're making a product, I didn't make it cheaply. I could have mixed this in my house and sold it to you. I'll make through a manufacturer, a company that has the proper designation through the FDA to be a safe and effective mixing of the product, number one. And number two, we had to go through the FDA labeling, make sure the label was the right size and the ingredients were the right size, that it wasn't mislabeled. That's why it says, use 3 to 4 times a day. Everything had to be done the right way. It's for me too. I use it. And my mother uses it, and my sisters and my brothers and my patients use it. I wanted to make sure that I didn't cut any corners, made the best product that's safe, that's effective, and that works for them.
Coming up, I will share how the Dr. Carrasco Pain Cream is helping individuals who work in many different jobs, such as construction, short, long-haul drivers, office workers, and people who work at long hours at computers.
It was that bad. The pain was that bad.
I lost my job, I lost my back. It was horrible. So within those 2 years, I broke down heavy.
I've seen people's lives destroyed. I've seen families torn apart. I've seen people lost because of pain and not knowing what to do about their pain. And that's just not fair, because living with pain is not normal. People need to be aware of what's out there in pain and what pain does to them in their lives and to their families, and that there is hope.
If you or someone you know is living in pain, please seek help. You don't have to live with the pain.
The Dr. Carrasco Pain Cream is helping individuals who work in many different jobs, such as construction, short, long-haul drivers, office workers, and people who work at long hours at computers.
I'm a registered nurse and I specialize in orthopedic surgery. During orthopedics or before the procedure, we have to do preps and we hold extremities up, and they're very heavy, very taxing on my shoulder, my lower back. Before surgery, I apply Dr. Carrasco's pain cream to my shoulder and my lower back. That alleviates my pain for the whole shift.
I applied the Dr. Carrasco Pain Cream I would use on a daily basis. Every night whenever I put it on, I was able to sleep better.
When I have pain, I reach for Dr. Carrasco's Pain Cream rather than a pill because I don't want to take a lot of medication. Dr. Carrasco's Pain Cream makes me more functional. My family loves Dr. Carrasco's Pain Cream because it does work.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
Welcome back. I'm Dr. Carrasco. We're talking about the pain cream I created called the Dr. Carrasco Pain Cream. There are people who have acute pain and people who have chronic pain that started yesterday, pain that started years ago. This helps those individuals. Let's talk about who can help.
I've had low back pain for 4 years now. When I use Dr. Carrasco's cream at work, I'm more functionable because I sit all day And so that's very painful. So I get up and I roll it on just right there, and it really helps. My coworkers always ask me when I come to physical therapy if I can purchase a cream for them because they really love it. I shared it with them. When Dr. Carrasco's pain cream came out, I fell in love with it.
I have shoulder and neck pain. Commuting to and from work for an hour each day, especially during rush hour traffic, tends to put a lot of stress and agony on my shoulder and neck. I like to apply Dr. Carrasco's pain cream right before I go on my motorcycle. It tends to loosen up those muscles, feeling less pain and making my ride a more enjoyable trip.
Arnulfo, when you go to the supermarket and you're hurting, I mean, you just want something for pain. You've taken the over-the-counter stuff you can, and you go, and there's a line of bottles over there. So for you at home, educating the consumer is, when you go on the over-the-counter market that is not regulated by the FDA, it's not the same thing that when you buy a product from a physician that did it and that did take FDA recommendations and guidelines into doing this, and that's what you did.
Absolutely.
That's absolutely what you did, right? So I commend you on doing that. Now, I see patients every day, you see patients every day. How did you do this?
I'm a pain specialist, as you well know, and you're an arthritis specialist. So we see people with pain all the time. They've been in pain for whether it's 2 weeks or 2 years or 5 years or 10 years. They're in pain, and they need another solution. They don't want another pill. They don't want anything that's going to give them a side effect. They don't want it's going to upset their stomach. They don't want something that's going to interact with their bleeding problems. They don't want something that's difficult to put on because it smells better, because it's greasier, because it stains their clothes. So I took all that information over 25 years of experience and said, let me create a product that's safe, that's effective, that takes away all these things that people don't like and make my own pain cream. But we also wanted to make sure, it says it right there on the label, and that it's fast-acting, long-lasting pain relief. But equally important, because people have maybe difficulty with their bleeding, they're on blood thinners because of the heart condition, or for whatever reason the doctor has them on a blood thinner. We took out all the aspirin, all the salicylates, anything that will make you increase the potential of bleeding. And plus, because it's applied on the skin, very little of it is absorbed, so it won't affect you like everything else that you would take by mouth.
But this gives them a choice beyond any kind of medication, doesn't matter what medicine they're on, to do something that's topical and that's pain relief.
I wanted something that's affordable. It is not the least expensive thing on the market, but in my opinion, it's the best. I've tried many of them. It's the best in the market, and why buy something cheap that doesn't work when you can buy something that works at a fair price? I wanted to make it affordable to everyone in the marketplace.
Your pain cream, does it need a prescription, or the patients can order without seeing you as a doctor?
The options are, you can make a phone call, and we'll send it to you directly at your house. It's not available in stores at this time. Okay. So the way you buy it is, give us a phone call, we take your information, and we mail it directly to your house. You can go online on the internet, CarrascoPainInstitute.com, look up the product, order it online, and we send it to you at home. Coming up, I wanted something that would give these people the relief that they need to, and give them an option so they keep it with them. That's like, it gives me the freedom that if pain comes today, I got something I can put on it.
My whole family is very athletic. They play baseball, they play basketball, they play volleyball. With that, they have a lot of wear and tear. When they have pain, I usually apply Dr. Carrasco's pain cream. If I have a choice, I don't like to give medication. The benefit of Dr. Carrasco's pain cream is it's all natural. It allows them to perform at a peak level, and it works very well.
Been a runner for 8 years now. I used Dr. Carrasco's pain cream and it seemed to have a very good effect. I'm feeling pretty good, a lot better. I'm training for about the 10-miler range to a half marathon.
When I'm playing soccer, I tend to turn a lot or torque my knees, so that cartilage of mine tends to really hurt. So I applied Dr. Carrasco's pain cream and it really helps with my knee pain.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at CarrascoPainInstitute.com. Hello, I'm Dr. Carrasco, the Pain Doctor. I have dedicated 25 years of my life to treating people who suffer from pain. I created the Dr. Carrasco Pain Cream, a safe, effective, natural way to relieve my pain and your pain too. It is an over-the-counter pain reliever, which means you do not have to be my patient and you do not need a prescription. In fact, it has changed the lives of thousands of people who are using it today to relieve their aches and pains. It is available for anyone to purchase with these simple options. One, you can call our office at 210-614-4825. On the internet,
Go to the CarrascoPainInstitute.com and click the buy or gift button. We'll send it directly to you or the person of your choosing. And finally, you can come by the Carrasco Pain Institute in San Antonio, Texas, and pick it up at your convenience.
Dr. Carrasco's pain cream can be purchased at a simple price of $20 plus shipping and handling. The Dr. Carrasco pain cream is not available in stores. Buy it today.
Welcome back. Today we're talking about one of our favorite topics, how to treat pain. Today with the Dr. Carrasco Pain Cream. Arnulfo, you see an offer on TV for pain for a cream. And one thing that stands out is does they have a product guarantee?
Well, you know, the guarantee is if this product doesn't work for you, send it back to us, we'll give you your money back. You know, I've sold thousands of these, Alex, tens of thousands of these.
How many have you gotten back?
And I've never gotten one back.
Not even one?
And no one's asked for their money back, no one's brought it. In fact, what happens is they come back and buy more. Again, for their sister, for their mother, for their aunt, their grandmother, they end up buying more. But what's important to me is the fact that I wanted to create a product that would really work, that would help these individuals, give them another option, whether you had pain from yesterday that just started from running or overworking or overdoing, or you had pain from your job where you type all the time, or your repetitive work like at a factory or working construction, whatever may be the case. I wanted something that would give these people the relief that they need to and give them an option.
I use Dr. Carrasco's pain cream for my diabetic neuropathy, mostly my left foot, and it really, really works.
And I'm like, oh, I don't think it's going to work. But I finally bought some, and I'm using it regularly now, and it really helps me.
It has a nice minty smell, and it really cools the back of my neck. Instead of me having to put an ice pack on, I can put the Dr. Carrasco pain cream on.
I love Dr. Carrasco's pain cream because it really helps. It feels comforting and soothing when you put it on, and a roll-on. I really like the roll-on.
Dr. Carrasco's pain cream is a quick-acting, long-lasting pain relief in a comfortable roll-on. It can be purchased at a simple price of $20 plus shipping and handling. Call 210-614-4825 or online at CarrascoPainInstitute.com. The Dr. Carrasco pain cream is not available in stores. Please select from the two convenient purchase options and we will send it to you immediately. Buy it today.
Today we've been talking about the Carrasco pain cream. Dr. Carrasco formulated this pain cream through clinical trials, put 17 ingredients, natural ingredients all together, topical with very minimal side effects. Really, it's a pain cream that almost anybody can use for any kind of pain.
Thank you, for your own testimony, because I know it works for your patients. We share some patients together, and it works for mine. And luckily, we'll continue to use this for patients for a long, long time.
I would recommend Dr. Carrasco's pain cream to anyone. It definitely works.
For positive feedback, for good feedback, we would appreciate your comments at the bottom of the screen to our website or to our phone number. Thank you, Arnulfo.
Thank you, Alex. Appreciate all the great questions. For Dr. De Jesus, I'm Dr. Carrasco. I wish you a life full of health, hope, and healing. God bless you till next time.